Okay. Welcome, everybody. This is our next session of Lynn and Skin with Lynn. And today our topic is excrescences, warts and skin tags and HPV and all those lumpy things that happen on people's skin. So Lynn was just saying that she wants to teach us how to think better. So tag you're it, Lynn.
Yes, so it bears repeating. I don't have the answers for your case. I have the answer that helps you to think out your own case, because I can't be there. And I was just telling Karen and whoever was early on, I just inherited a case from another wonderful homeopath, experienced homeopath. But unless you have a way to get there, falling back on sulfur or whatever is just not going to do it, folks. These are not in the can answers. And I don't have any in the can answers today. But what I'm hoping to do is what I did for Karen many years ago. I'm going to help you look at the problem homeopathically. I'm going to help you look at the repertory. I'm going to help you see patterns in remedies, in the repertory, in materia medica. So your client comes in and you have a chance. You have a chance to solve it. Repertorization is always going to lead to these small rubrics. That can be so dangerous. We have so many new remedies behind us now. My goodness, I spend half my day reading new materia medica. Really, I do. And then I make little notes in my repertory to remind me, to remember, for example, well, I'm not going to give away my class on psoriasis, but whatever. So, it's about thinking better, because warts, skin tags, excrescences. I love how your face got all kind of smushed together, Karen, when you said those words, because people will come that they aren't getting relief for various reasons. I don't have many people come with those problems as the first problem, because it's kind of expensive to come to see me. So if they want to come just for warts, I will tell them over the phone, go try Thuya at the health food store. If it doesn't work, save your pennies and come see me. Because 80% of the time, Thuya is not working at the health food store. And this I know, duct tape is maybe helping more than Thuya sometimes. Everybody's
I have a fair number of clients who have tried that.
We'll get to all that, the duct tape cure.
Yeah, especially with the plantar warts.
There you go. But I've also seen it fail miserably. So
yeah,
whatever.
Okay, well, let's just ask at the beginning, for the group of people who are on the call, are you seeing clients who have warts? Or for those of you who are students, have you seen this in clinic? Or have you had this in your own case or in your own clients, your own kids, your own family circle in a way that has got your attention?
Okay. Marjorie says, yeah.
Some of them, we're seeing some yes with that. And I see these things change quickly when you get a good remedy.
Yes, I see warts fall off in a week or so. It's freaking amazing. So you can get a reputation for doing this, and then that will up the ante of you curing every case. So watch out. Because I know it's not Thuya most of the time, it's a little bit more challenging for me, because I will tend to want to see the more challenging cases overall. I want to see the stubborn cases who've tried everything at the health food store, and they've been to the doctor, and it's still all grown back, and now they have scars and all these problems. So let's start at the beginning. In your repertory, what I observe about the repertory with this problem is whoever wrote that thing tended to put these words all over the place that mean the same thing or a similar thing. So we have rubrics like excrescences, right? So we have skin excrescences. We have we have psychotic miasm, syphilitic miasm, we have condylomata, we have warts. Most of this is interchangeable because they didn't quite know what they were working with back then.
Mm-hmm.
They were just more descriptive rubrics per se. So you can kind of smush them all together and then parcel out the modalities. When it comes to genital warts, that's a little bit different because I think they did know that this was sexually transmitted back then. But we now know that all warts are viruses. So whether it's genital warts or warts on your hands or your feet, it's a virus, folks. And that's something the general public may not be aware of. They don't know it's a virus. And so their attitude about it is you should just take it away and it has nothing to do with an infection. And they don't realize how contagious it is. They don't realize you can pick it up in public shower rooms because of certain factors I'm going to get into. They don't realize that anytime the skin is broken, you are at risk for warts because on every surface around you right now is the wart virus. That's how prevalent it is. It's really everywhere. So this is an opportunistic infection. So when you get a wart, you have to ask yourself and possibly your client, what was going on that you picked this up and took it home with you? Commonly in my experience, this breaking of the skin is a huge factor. I will see it when they're using, the public showers at the pool, at the gym. And the kind of water there is going to have a lot of chlorine in it. And that's going to break down that first layer of skin. And then that wart virus says, oh, happy day. Oh, happy day. Another time the skin breaks down, and I see this on people's feet and on the palms of their hands, is when people perspire a lot. And they have sweaty sock syndrome or sweaty hand syndrome, which you know when you first meet them. And I know right away that's why they have warts, because that constant wet dampness breaks down that skin, that first dermal layer, and the virus can make an entrance. So in our thinking as a homeopath, the first one, the showers, that's mechanical. That's something they can either change their gym or wear flip-flops, or they can get those special shoes for wearing in the shower. But the sweaty hands and palms, that's a constitutional issue, folks. That's no longer trauma. That's somebody being kind of nervous inside. And if you don't treat that, they can cut them off, blaze them off, duct tape them off, and they will come back because the very ground is just ready to have the virus all the time. It's always that friable, we call it friable skin. It's just breaking down. It's just like when you've been in the bathtub too long and your skin kind of gets, woo, it goes, ah. So when the skin breaks down like that, you will see the virus can easily enter. So other possibilities can be that children or adults with eczema who have the broken skin, you may see warts with the eczema. Now, which brings up a really good question. I mean, which should you treat? Well, yeah, you should treat the eczema, because if that heals up, there won't be any place for that wart to live anymore. And it has to drop off. It has to go. I have to go home now, back to the surfaces. So these are tough decisions for you to make. Are you dealing with warts that are from this traumatic thing of just poor hygiene or poor, use of your body in the world? Or are you talking about something else much, much more deep? And the ones I typically see are the eczema, the hyperhidrosis, which is the sweating of the hands and the feet. And then the bigger one of all that I think encompasses everything is really a lowered immune system. And that's how I see warts most of the time. It's kind of like just a red flag that says, hey, the immune system is just down like that. And if we bring it up a little, the warts can't flourish. So to me, it's a sign that the immune system is compromised. And so you will see more tendency to warts in people on immunosuppressive drugs, whether that's cortisone, methotrexate, or some of the new ones they're always coming up with for the different arthritises and things. So these people are at risk and they know it. They know it, but people don't know it. So are you going to be the one who tells them? I often am, and I'm not really popular because of that. So then we have, when we come to the genital warts, we have sexual transmission. And in getting ready to talk to you guys about this today, I want to give you this viewpoint, whereas you can look at rubrics and it can like open up for you. The rubric can speak what you need to know. So if you go to the rubrics for both female condylomata and male condylomata, and you can just look at that rubric and just scan the remedies in there. One of the fascinating things I found today that escaped my vision before was that there's a small subset of remedies that have to do with trauma. Calendula, staphysagria, millefolium. So in my mind, what's happening, and this has just happened in the past hour or so, is I'm realizing that some people are going to be predisposed to genital warts through their constitution. But some people have suffered a trauma, sexually a trauma, and simple remedies like calendula, millefolium, staphysagria are going to raise their immune system enough to resolve that trauma and get rid of those warts. So that's incredible to me, that we really, in the rubric alone, we have these two huge possibilities of trauma maybe, or constitutional, more constitutional.
Lynn, do you want me to show the rubric? Do you want to talk about it a little bit?
Can you show the rubric?
Yeah. All right. So are you able to see? We've got condylomata.
Yeah, there's condylomata, and there's the calendula, and there's the staphysagria. Now in some other rubrics, you're going to find the millefolium, which calendula and millefolium, Karen wants me to put together a list of things I can teach, and I used to teach a whole day class on the compositae. Millefolium and calendula are part of that great family in the world, the compositae, of which we know that, arnica is the lead remedy. And so calendula and millefolium have this synergistic or similar action to arnica. And I've just learned so much about calendula in the past few years. Everything from cutting my finger off to things like that, where, it's just amazing stuff. And millefolium as well. It's just tremendous remedy. So, and Staphylococcus aureus, I mean, most people know Staphylococcus aureus well enough to associate it with sexual trauma. What we're talking about is probably trauma to the cervix. And then with that trauma and the resulting change in state, you have this opportunity for the virus to make a home. And then we look at a whole bunch of other remedies. You know, if I was going to throw this up on a screen, and I don't have that possibility right now, I break down a rubric like that into families. And then I ask myself, what are those families doing there? So that's kind of my strategy when I study these things. I'll look at rubrics, but not because I need to understand individuals. I want to understand why whole groups of remedies are there. And one of the things that happened in preparing for this is, you know, there's what I call, what do we call it? Home remedies for warts. Mm-hmm. And I like to study those things because I think people are usually onto something. They're trying something out in a culture, in a you know, different times and places. They've tried things out and some things work. So for example, the duct tape thing. Who knows why the duct tape thing works? Maybe somebody should do a proving of duct tape. You know, maybe there's something about the synergistic action of the glue or whatever is used in duct tape. I mean, you know, duct tape is a universal remedy for many things. If you have duct tape, you can, you know, bind somebody's wound or bind someone's broken limb while you take them to emergency care. So duct tape, it's called duct tape occlusion therapy. This makes me laugh so much. Occlusion means to completely suffocate or close off the wart. And this seems to work for some people. Nobody knows why. I haven't seen it work a lot, but people try it. I tell people to try it. The other big one you've probably heard about, Karen, is ritual. Ritual has always been known to help warts.
Right, right.
You
and
know,
I have people who come to me who did this and it worked.
It works.
They did a thing, they buried it in the backyard, it was at the full moon, they made a sacrifice.
They turned around 10 times and gave it back to God. I don't know, whatever they did. But to me, when I hear that ritual works, I think, oh, that's either thuya or phosphorus. So to me, for the people that ritual works, it's suggestibility. It's the principle of what Hahnemann said we could use, which is we can use some creative visualization. And if it goes, it's good.
Oh, that's interesting. Hey, Lynn, I pulled up all of the remedies that have, or all of the rubrics that millefolium has in the male and female anatomy. And it's so interesting here that, you know, millefolium as a women's remedy, it's used for all kinds of hemorrhagic stuff. And so it shouldn't be surprised that we see condylomata that bleeds easily. Yeah. And millefolium's right there.
Because millefolium is so much about the blood vessels. My first case of millefolium was when a woman came for constitutional treatment, but she had received an injury on her foot to a blood vessel, and it had formed quite a knot or a bulge, a lump. I thought, easy case for arnica, right? Any homeopath worth their salt has got to give arnica. So I gave her arnica for that. And she came back in a month for her constitution, and arnica had done nothing, Karen, nothing.
Oh, wow, wow.
And so I looked it up. I looked a little further. I actually opened the book. It does help sometimes to open the book. And that's when I learned direct injury to the blood vessel like that, millefolium, and that was the ticket. It's the main remedy I give for repeated injury to the blood vessel with repeated, blood draws and things like that.
Mm-hmm.
I don't find that arnica helps. I find that sometimes ledum helps, but many times it's millefolium because they are actually bruising the blood vessel over and over again.
Oh, very interesting.
That whole quality. Yeah. Yeah. I could write the book on post-surgical and post-allopathic care trauma because really that's what we're talking about here.
Yeah.
So, the home remedies of duct tape, maybe that's Thuya too. Who knows? I don't know. I honestly don't know about the duct tape. But the ritual, I think Thuya, phosphorus, that sort of thing.
So can I ask you a question about a Thuya relative? In HPV, I use Sabina a lot, which is a Thuya relative. And it's actually, the same as the gemotherapy tincture. It's made from the new little buds and shoots of the Sabina plant. And it has a very high level of potassium in it. And so I think of it as Thuya plus Kali carb with the rigidity and ritualistic thought of, that's an interesting thought.
But does Sabina have the susceptibility to suggestion as much as Thuya does?
Yeah, I don't know. I would have to go and find that out.
Have to go find that out too.
Yeah, but I see it a lot with genital warts.
Okay.
Yeah. And
so the other
one of our guests, Mike, put a note in there. The observation about sweat and warts is intriguing on sweaty hands because a lot of our sweaty remedies, are also warty remedies.
Yes, they are. The calc carb, the mercury. Yeah. The silica even. Yeah.
Yep. That's what he's got in here. Silica, Thuya, lycopodium.
So that's what I mean. It's one thing to just choose a remedy because it's in the rubric. And it's another thing to understand the dynamic that is creating the environment for this sort of, virus to flourish. And if you can get under that virus to the cause of why that virus can flourish, you're going to have a much better cure, a much more solid cure than just trying Thuya, for example. They can buy Thuya at the health food store, for probably less than $20. And it costs a way lot more than that to come to see me. So, another home remedy that's out there, I guess, is silver nitrate, which makes me feel, once again, they're onto something because the nitricums play such a huge role in warts, whether it's nitric acid, argentum nitricum, or, that whole angry nitric sort of feeling.
Right. Now with silver nitrate, you're talking about colloidal silver? What are you, I don't know what form that silver nitrate comes in.
They're using it as a liquid drop, and it's silver nitrate.
Whoa.
It's not colloidal silver, it's silver nitrate. People are dropping this on their
Isn't that what they used to put in babies' eyes? As an anti-gonorrheal.
Yeah. Anti-gonorrheal. So
right, long ago. Yeah, we're right back. So we have a question from Linda. She says, I guess plantar warts on the feet are apart from this. I'm not sure I could say that.
No. All of this is the same. Just because they're on the feet doesn't make any difference. This makes no difference. I mean, there's different kinds of warts, but we're still talking about a virus. There's over 100 different types of viruses involved in warts. So the early homeopaths didn't know that. So all of this is still all these remedies. That's not what's going to help you, is that it's on the foot.
Yeah.
The location is not going to help you as much as a description, a modality, or a sensation. In fact, I want to repeat that. Location is not going to help you as much as sensation, modality,
description.
Yes.
Okay, and by description, you mean something like the appearance of it.
If it was bleeding, if it was black, if, if it was cauliflower, if it had
Mhm.
a long stalk, those might help you. Yeah.
Mhm.
Yeah. Yeah.
And it, you know, one of the things that's unique about plantar warts in my practice, I very, very seldom see a wart that hurts, but plantar warts often have pain
Mhm.
when they're standing on it, walking on it, bumping it, something. Do you see cases where warts in other places are ouchy?
Mhm.
Do you?
Yeah, I do. And
Mm.
that's why they want to get rid of them. Yeah, but it's more likely in the plantar wart, but I've also seen plantar warts that had no pain. So it's probably about how much keratin has built up. And keratin, I don't know if you have any of these. I have a couple of these on my body. Keratinaceous plugs. We all know about sebaceous plugs. That's a pimple. But keratin is that top layer, and if it goes in like this and then gets blocked, it can form a keratinaceous plug. And that plug can feel like you've got a piece of glass or a nail inside of you. And I think that's what's happening with these plantar warts that cause pain. They've got a lot of keratin that's involuted, and then that feels like you're walking on a pebble or a piece of glass. Do you follow me?
Yeah, that makes perfect
But
sense.
there's some warts that don't produce that much keratin, and then you wouldn't have that sensation. Does that make sense?
Yeah, yeah.
Yeah, keratinaceous plugs are really like having a little stick in you. It's very interesting. More and more the dermatologists feel, why don't more people have this? Because they understand now that our skin can fold like that and get stuck. It's very, very interesting. They don't know as much about us as they used to pretend.
And
Anyway,
as they would like. Yeah.
as they would like. Another home remedy we see for the warts is salicylic acid. And we have a remedy made from salicylic acid. I have never tried it in warts. Maybe we need a better proving of salicylic acid. I don't know. But certainly that's one of the main things you can buy the, at the drugstores. You can buy a salicylic acid solution and try to burn it off. But salicylic acid is aspirin. So all these things, it's fascinating to me. We've been using aspirin now for what, 50 years, 60 years? There's so many consequences of salicylic acid. It destroys hearing. It's ototoxic. It thins blood, but not necessarily in a good way. It actually increases your risk of cardiovascular accident. So it's a deeper remedy than we know, and it probably deserves a higher proving than it's got in our materia medica.
Mm.
Maybe we would find that it too is part of that group of traumatic remedies for warts.
Mm.
Because
Yeah,
it comes from the willow bark, right? It's coming
mm-hmm,
from the willow bark. So
mm-hmm.
there's some sort of trauma there, the willow.
Right, in that, yeah. And it's listed in the rubrics for warts of the fingers and warts on the finger joints.
Hmm. Hmm. Who knows? Yeah. Well, if you were making baskets out of willow, maybe you
Right,
can open
right.
yourself up to that. Yeah.
Yeah.
That's what I like to think about. I like to think, how is it really connected with the source? And I think I learned that from Franz Vermeulen most of all, that we cannot deny the source of our remedies. A remedy can't do something it can't do. In other words, if it doesn't have something about it that can heal the skin up, then it can't heal the skin up. You can have all these ideas that remedies can do everything, but it's not true. They can do what the source can do. And we can't forget that in homeopathy, just because we're using such an attenuated dose of it.
Yeah. Hey,
So,
Lynn, we've
yeah,
got another question from
sure.
Stacy. Salicylic acid is ototoxic or autotoxic?
Oto, O-T-O, ear. inner ear, toxic to the inner ear. So it can create tinnitus. It can basically give you dizziness. I'm one of those people who can't take any of the NSAIDs because of that. They're all ototoxic. So yeah, salicylic acid isn't just some benign thing, just like calendula isn't some, wimpy sort of remedy.
Yeah, I've actually
and,
seen it work
and
in
we can,
severe pain.
Yes, of course.
Yeah, and I think
Calendula is not a
there's
wimpy.
a tendency for homeopaths to say, oh yeah, that's given in tincture. And right
Right.
now I've been preparing I'm teaching a class, an organ therapeutics class on neuralgias, and actually using tinctures instead of potentized remedies, which are incredibly powerful for pain. And we as homeopaths tend to be like, those tinctures, give me a 30C, give me a 50M, but those tinctures do a heck of a lot of stuff.
When I cut my finger off, I cut off a large chunk of my finger. And as I was walking into the house, I kind of downloaded all the homeopaths from the 1800s into my brain. And the first thing they said was, pour calendula tincture on the wound. Because it was an open wound, very open. It wasn't, a straight cut. It was this huge chunk I had cut out of my finger. And do you know it knitted together in 3 days?
Oh, wow. That must have hurt like a son of a gun.
No, only after I took arnica.
Oh, and brought you back in your body.
Yeah, exactly. Anyway.
Yeah, it doesn't hurt when you're out of your body.
It doesn't hurt when you're out of your body, Karen. That's another thing you should know about arnica. So another of the home treatments, out there for warts is zinc preparations. And I didn't know this, but it makes sense to me in looking at it. And particularly zinc oxide can be used. But what people don't know about zinc is having a deficiency of zinc makes you open to a lot of things. It makes you more susceptible to viruses and bacteria. We know this because they put it in Zicam and they put it in airborne. So when you start to think about it, it makes sense. Oh, zinc. And on top of that, all the snake venoms are deficient in zinc. And hence, the snake venoms all get warts.
Oh, wow. I've never heard that.
Yeah, this came from Franz. He said, snakes are prone to live in areas where the soil is deficient in zinc. And hence, people will get those white spots in their fingernail beds. And that can be either a calcium or a zinc deficiency or both. But in my practice, it's 9 times out of 10 a zinc deficiency. So this zinc deficiency, and let's face it, we have an agricultural world in which those micronutrients can be lacking. So zinc deficiency, yes. But if you have a susceptibility to zinc deficiency, then even more susceptibility is there, and that is the snake venoms. So I don't know how much lachesis shows up in the rubrics for warts.
Hang on a minute and I will find out.
But I can tell you, if you see lachesis in any rubric for warts, it's all the snake venoms.
Right.
So,
it's just the template. Yeah.
Easy. It's just another snake venom. So, yeah. So that's my 2 cents worth on zinc. So you can see how I'm thinking about how home remedies are trying to get to that place that we can go directly with homeopathy. They're trying to get there. And I can imagine some people have good success. I really do. Because in the end, it's homeopathic for them. Then garlic extracts came up.
These are all the rubrics that lachesis shows up in.
Wow, look at all of those warts and excrescences. Wow, that's fabulous.
Horny, flat, painful crops.
Yeah. As I'm fond of saying, if you're in the room with two other people, two of you need a snake venom. If you're alone in the room together, that might mean 100% of you need a snake venom. My experience with other homeopaths is probably 60 to 70% of all homeopaths need a snake venom.
Oh my goodness.
And I'm not joking. Snake venoms are usually very attracted to the medical arts. So whether you're chilly or hot, I don't care. Whether you're quiet or loquacious, I don't care.
Right, there's a snake to match you.
There is a snake to match you. Sorry.
It's interesting to me about homeopaths and snake remedies, because in the shamanistic tradition, one of the things about snakes is that their role is that they speak truth to power.
Truth to power.
And we as homeopaths are that voice saying the vital force is orderly. It does make sense. The whole thing about medicine being random and, it's not true. And, we are there as an alternative voice. It, sort of pissing in the wind, actually, most of the time, I think, as a tiny little profession, but we're the dot, in the yin yang thing, but we're there speaking truth to power.
We're speaking truth to power. Sweet way to put it. So I just wanted to finish off these home treatments that I noticed today. There's probably more that I haven't noticed, but this is how I think about these things, you guys. And that's what I want to impart, is how I think about it. And I saw garlic extracts and I went, well, of course, garlic extracts. What is one of the main components of garlic extracts? Sulfur components. And the whole sulfur family is so involved in warts. We had a wonderful guy at I ran that homeopathic dermatology low-cost clinic for a while. And we had this wonderful guy come in. He had every kind of skin problem you could imagine. I don't remember if he had warts. He could have had warts. He had eczema, psoriasis, everything. He had contact dermatitis. Oh my gosh. And what a charming, wonderful, outgoing, friendly guy. And we just had to get it through our heads that this is just sulfur, folks. There was just sulfur. Don't make it harder than it seems, Lynn. This was just sulfur. So, the garlic, once again, it's an antiviral, right? So it makes sense, the garlic extracts. So, we have in those rubrics things like sulfur, causticum, calc sulf, natrum sulf, big remedies for warts. So the sulfur, important. Carbon family, the sweating family. Calcarea, graphites, antimonium crudum. The potassium family, you mentioned that. So the potassium family is huge, back to causticum, and every kali you can imagine is in the condylomata groups.
Kali nitricum, I have used so much for condylomata for men. Men get this thing with warts that go all up the urethra and then fill up the bladder.
Wow, I didn't know that even existed.
And they do a surgery where they split the end of the penis and open it up, and then they can burn all of the, and I'm like, why would you do that to your equipment? Let's just give you some Kali nitricum and get this taken care of. Wow. But a lot of guys come to me after they've been through that procedure a few times, and can you imagine? Ouchie, ouchie.
I cannot imagine.
Yeah. So Kali nitricum is a big leader. I mean, it's certainly not the only thing, but most of these guys are it's so interesting to me. There are certain professions that the Kalis are attracted to. Police officers, military officers, people where there are clear rules and you follow the rules, Coast Guard people, you know, all those folks, those guys were the ones who had this.
Wow.
And the Kali nitricum was, you know, out of all the
were
differential.
these genital warts? Were these?
Yeah, I don't, you know, so some of you who are on the class, have any of you guys seen some of these things where you've seen Kali's, where you've seen some of the home remedies that Lynn's been talking about, or other home remedies that you've seen in your own area? You know, you guys are all across the country, and which means that we're all in different environments.
Yes, we are.
You know, if you're in the desert Southwest, you're going to see this manifest a little differently than if you're in freezy northern Minnesota or soggy Portland or hot and humid Biloxi, Mississippi. You're going to see it completely differently, right, Lynn?
Yes, and thanks for bringing that up, because not only does water, soggy, perspiring hands and feet break the skin for the wart, but dry weather, like here in Sacramento, we have more the Reno, Arizona, Las Vegas feel, where it gets so dry in the summer here that everybody's feet begin to crack. And that's a perfect opportunity for the virus. So we do have hygiene issues we have to attend to here in terms of where are you living, and what kind of environment is putting pressure on the organism, drying you up or making you too wet. Yeah.
So we have a naturopathic question about banana peels.
I haven't tried that one, but that would be a potassium.
Right, that's what, maybe because of the potassium. That was the comment. Yeah, thank you, Marjorie.
Potassium group, yeah. I'm glad I'm getting you thinking about this, you know. And the other thing, when I look at these rubrics and I see just one mention of lac caninum, then I know that all the lacs are covered. So, you know, unfortunately, I've really actually opened up the box of possibilities for you rather than doled out a few answers. I've opened it up to a lot of possibilities here. The stramonium family with dulcamara is certainly represented. The mercury family is huge, of course. Every mercury, I think, when you showed that one slide,
yeah, there's a lot of it. Cinnabarus comes up very high, which is Merc sulf.
Right.
And this is one of the most common remedies that I end up using for women with HPV, where sex becomes so impossibly painful.
So I do want to introduce people to a product by Des Bio called Condolamata Series Therapy. And let me get you the inner contents here. Basically, this is a no-sode therapy. So this brings us to several strategies. You have a traumatic strategy to treat it traumatically with more, you know, the millefolium or the calendula or the staphylos aureus. Then you have a constitutional treatment. But I often, in stubborn cases of anything, and I mean anything, I am going to do an intercurrent no-sode to boost the immune system. And so they have this series therapy box, which is, it's basically condolamata I forget which, adenovirus 18. So I said there was hundreds, there's only one in here, but generally what we're doing homeopathically is we're just invoking that response, and it's broad enough to cover everybody. And then they do this in a very unique way. They have a series of 1 through 10 vials, and they'll start with some low potencies and go up to high. And then you're supposed to turn around and go back down. And so that's what I have people do. This takes 60 days for people to do. And I find that it helps quite a few of my cases. I wouldn't say it's more than 50% of my cases, but certainly with the stubborn ones or people who have a long, long history of something. you want to start to get beyond. And some of the cases I read on the internet about warts, they were also using intercurrent things like metarinum or intercurrent carcinosum if it was more genital warts, because you want to prevent the cancer, right? You want to prevent it from going into cervical cancer. So that strategy I really wanted, before our time ran out, to remind you of. And I use these a lot. They're convenient. People get a kick in their pants when they do this stuff. They will
and people like them. They'll ask me.
Will they?
Yeah, because I'll have a client that I have somebody that I'm working with now who was doing a series therapy for CMV, somebody who crashed after having mono, really had a hard time. And we did constitutional care and we did some intercurrents with that. Called me back, was doing great, called me back 5 years later, I'm crashing again. Can I do that series thing again? I remember how much it helped me.
Wow. Wow. Anyway, I just wanted to bring that up because in today's world, people have so many factors that prevent full healing, and everything we can do, whether it's an intercurrent nosode, intercurrent metarinum, intercurrent carcinosum, intercurrent syphilinum, whatever is appropriate, I think it's always worth a think. Maybe you don't have to do it, but maybe it gives your patient that extra little boost and it can make a difference for them. So I wanted to bring it up.
So I have a question for you about when they get the boost. Like both of us have seen cases where when the remedy acts deeply, the warts go away in a very short time. It's a matter of days and weeks.
Yeah.
It's not a matter of 6 months from now, you might see it begin to change. If it's not changing in days or weeks, you haven't touched that part of the case yet.
Right.
So one of the things that happens sometimes that I look for, particularly in HPV or genital warts, I'm looking for a discharge. This is something that Fubister used to teach. And for women, very often when there was some kind of initial thing, as they get better, you see some kind of icky, gunky, smelly discharge. Not always, but often. And sometimes you'll also see a fever. And I kind of like it when somebody has a response where they run a fever, because I think, oh, their immune system's coming back online. This is one of the ways that it modulates what can and can't live in the organism. Do you see that? Or does anybody who's online?
Because I don't deal with genital warts much at all. That's, I'm not dealing with the reproductive genital system exclusively so much like you are, Karen. No, I don't. But I would welcome it. And I think it's probably, Karen, because you are seeing a wart on a mucous membrane. Whereas I'm seeing a wart on a cutaneous surface.
Right.
Remember, the cutaneous surface and the mucous membrane are totally different levels of the organism.
Right. Okay. So
yeah, you're seeing a discharge.
So humor my curiosity. Mucous membranes, polyps in the nose.
Yes.
Is, and I just think, Thuya, is a polyp like a wart? Can we?
Well, it's an excrescence.
Yeah.
And I find a lot of these polyps due to what I call injury, whether it's fried food, whether it's snorting cocaine, whether it's eating spicy food, whether it's smoking tobacco, whether it's drinking alcohol, it's an injury.
Well, and I find the same thing with cervical polyps on a friable cervix. After somebody's had bacterial vaginosis and they end up with warts or polyps or something on the cervix.
More to think about, less to know and more to think about.
Yeah. Okay. And we've got a note from Susan saying, yeah, she's seen the fever, when and the wart's gone.
Cool.
Okay.
I'll keep that in mind. We didn't get to talk about skin tags, but maybe we have 10 minutes.
Yep.
I'm not going to get to talk about SKs, although SKs, like warts, will just drop off. The stubborn ones will take longer, but the newer ones will just drop off or peel off like a Band-Aid. It's just amazing. But skin tags are really, really interesting characters. They're not warts, or they might be.
Oh.
You hear that?
Mm-hmm.
They can not have a virus in them, or they can.
Oh, wow.
I know. Weird, huh? So they are totally excrescences, though. And it seems that they often come with pregnancy. So there's a hormonal link here with increased estrogen and progesterone.
Oh, which we know modifies your immune system.
Yes.
If you read P.W. Shedd, he talked about this, that when people go through a hormonal disruption, he was a homeopath from New York. He was the first one that I was aware of who recognized this and said, oh yeah, when people go through this hormonal disruption, they are more susceptible to any kind of infection. Mm-hmm. We've got a question from Mike about SK, seborrheic keratosis.
Mm-hmm.
Okay.
I'm not seeing the question.
He just wanted to, in chat, he was just verifying that that's what you meant by SK.
Yes, SKs are seborrheic keratosis. So back to skin tags. I would say 80% of the time, though, when I see skin tags, and this is in the grocery store and everywhere else, because they are due to a disruption of the blood sugar regulation, whether due to obesity, prediabetes, diabetes, PCOS. So to me, they're usually about that. And they only go away when that's addressed. But there are these other ones that are viral and seem more related to the immune system, to the autoimmune processes that people are in. So it's an interesting thing. Don't think, oh, skin tags, that's just superficial again. Back to my previous mentorships. These are not superficial signs. The body isn't doing this just, throw out a skin tag. No, skin tags mean something, folks. And I can look at people and in a heartbeat, I know their blood sugars are completely a disaster.
Ah, okay. So is there, you know how some skin tags are very stalky and some not so much, and some are very flat and some get to be like little bubbles. Mm-hmm. Are there any versions of that you're aware of? This is more blood sugary. This is more.
No, not that I know of. I've seen people covered with skin tags.
Yeah.
They like to be like here and where the friction is. Now, some people want to believe that it's the friction that opens up the skin to a little HPV virus and then they get a skin tag. Well, they can believe that. But it can also be true that they have blood sugar problems. Mm-hmm. I have a doctor as a patient right now who believes it's the HPV virus, but she was also an alcoholic. So at the time she had them, she was also an alcoholic. So I'm thinking, I think she was working on having diabetes, really. Yeah. And maybe it's both. Maybe in the end, the blood sugar dysregulation and the openness to the virus, maybe this is all one thing. Yeah. So for her, I have to treat the underlying disorder, which is, for her, it's autoimmune and the reason she was an alcoholic, right? But don't just think, oh, it's just skin tags. No. And people will get them under their arms, they'll get them in their groins, they'll get them here, and it is unsightly, and they'll have their doctor freeze them off or cut them off or do all that stuff. But it's a sign for you, the homeopath, to pay attention to what's underlying. And that's really what I wanted to communicate today and in previous sessions, that these things are like reading a book on people's bodies. You know, I tell people I read your body like other people read the newspaper.
No,
And,
this is your comments about the blood sugar and the skin tags are interesting because there are several times where I've had clients who had gestational diabetes and developed skin tags during their pregnancy, during the gestational diabetes. And,
Absolutely.
you know, in school, I remember being taught about the cafe au lait spots of carcinosin. And that's one of the first signs of blood sugar dysregulation, especially on the back of the neck when you get those little patches.
Yeah.
But now we can also think about it in terms of skin tags.
Mm-hmm. 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 Yeah. You know, there's a couple ways the skin tells us that there's blood sugar regulation problems. One is the discoloration. Second is skin tags. And a third is called acanthus nigricans, which I don't know if anybody's ever seen it, but I have seen it. And imagine that there's a crease and it becomes black. And I see this usually more in people of a browner skin color, but it can happen in any shade that this becomes black, hence the nigricans. Acanthus nigricans. And it's a top symptom for diabetes, blood sugar issues. Yeah.
And it's in any of the folds or flexures, the armpit, the elbow, the back of the knee,
or like
the line of the groin,
flap, or a groin, or anywhere there's a crease. It will tend to like those places, but I will even see it in other places as well. It's almost as if you know, you've seen chloasma, you've seen the brown pigmentation on the pregnant women, or I see it on people who have blood sugar issues. But it's like even another step in that continuum of here the melanin has even hyperpigmented to this level, to a black level. So these are all very big pointers towards the blood sugar being dysregulated, and the lipids usually being dysregulated as well, but certainly the blood sugar. Yeah.
Okay, well, so if we were going to summarize this, and I want to invite any questions, thank you so much for what you brought to the table here. The first idea is that this is a viral thing, something that the homeopaths who wrote a lot of our references did not know.
They didn't know. No, they didn't.
So they weren't working with the same information that we are. That a lot of these home remedies actually have their roots in things that we can use as an idea around homeopathy to help our clients. That sometimes, based on breaks of the skin and exposure, we can be looking at remedies that are addressing the trauma of the injury that allowed the virus to enter. That sometimes this is going to be a miasmatic or a constitutional thing. That sometimes this can have environmental factors in it, that the underlying need is to have the immune system strong enough that it says to these viruses, sorry, you can't hang out here, go away. And also that times of hormonal shift and blood sugar dysregulation open us up to the immune vulnerability.
Absolutely. Wow. Yeah. It's actually a huge topic if you look at it that way. It's so many remedies, and I'm sorry that I'm not solving cases for you right now. I'm sorry that I can't say, oh, give this for that. But I hope I've opened up in a way that now when you're presented with these people, you can think a little bit more about it before jumping to giving through you. I mean, because I'm sorry.
So we have a question from Stacy. Can you share the name of the little treatment box again? Can you show it up to your computer so that it can focus really well? Up, up, up. Perfect. Okay, so this company is Desiree Biologicals, and you can get a professional account there. And this is called Condylamata for HPV, and these are called series therapy. You see here on the label, and they have series therapy for all kinds of different things.
I only use the ones that don't have remedies mixed in, because I'm a classical homeopath. I don't want them to add a bunch of remedies. I just want the no sode. I want it in this ascending or descending scale. And that way, I have one here for H. pylori. I mean, you have these too, and
Right.
they're very useful because they have a bunch of potencies. You're only giving one product to the patient, not a bunch of vials. It's all in the box,
Right.
So it's very easy to administrate.
Okay. When I speak, the recording goes to my face, so I need you to hold the box up one more time while I be quiet.
Okay, here we go. That good?
Okay, we got it.
All right.
Thank you. All right. And then there's one more question from Mike. He says, if there's time, this is actually a question from session 1, where you were talking about the importance of an accurate diagnosis and how difficult that is to get sometimes. What are the possible doorways into the case when the very best diagnosis from the dermatologist is dermatitis? Maybe that would be a good topic for our next session.
For next time, because I appreciate that question from you, because what I have found is there's a little bit of, let's not let the patient look this up on the internet by confounding the client, and then that gets transmitted to you, because dermatitis, I'm sorry, is a huge word. And we should talk about it. We should talk about what they're using as words. And then we can talk about how you can find things in the repertory, and how the old homeopaths also used a whole bunch of words. Wow.
Yeah. Okay.
So, like,
so let's have that be our topic next
Okay.
time. And then we have a question from Marjorie. Do you remember last time you had the remedy that covers Hashimoto's thyroiditis and the left earlobe pain? Some people had put a note in the forum about that. Can we have our answer?
Well, who did their homework?
A couple of people put notes in the forum.
Oh my God. Did I not get a link to that? You gotta help me, Karen.
Yeah, sorry about that.
What are some of the answers you gave?
Nat carb was one of them.
Okay. Let's go to the repertory, folks. Oh my gosh. Ear, pain. I have to find this again for you guys? Ear pain. Okay, we have to go to the earlobe. I don't know how to find the earlobe. Oh my gosh. There it is, lobes. Okay, so I'm at ear, pain, lobes, left.
Okay, hang on.
Tearing pain. I only have 2 remedies.
Where do you have the, hang on a minute, and I'm trying to find your location.
I'm using Synthesis 9.1. I'm woefully behind by several decades, but it got me there.
Okay, hang on just a second. All right, ear pain, general, about the ears, above the ears, below the ear, lobule.
I think that would be right.
I think that's as close as we might get.
And then left lobe.
Okay, let me scroll myself down here.
No, this is not the right one. No. So this might, what are you using? What's the repertory you're using?
Complete.
No. Well, it is there. It is in your rubric. Go back one. It is in the left.
Back down.
Go up to the left. There you go. Okay.
This is like driving with your eyes closed while you tell somebody else.
Doesn't it feel that way? There we go. No, you're not.
Morning, daytime, left.
There you go. Okay.
And below this, maybe we can see if
in my repertory, which I prefer, not the complete. I don't prefer the complete. There's only 2 remedies, and the 2 remedies that are in the left lobe are arsenicum and muriatic acid.
Oh, and so here we have.
There's your muriatic acid and no arsenicum. So there is such a difference between complete and synthesis.
Yep.
I prefer synthesis. Yeah. So muriatic acid is one of the top leading remedies in Hashimoto's thyroiditis. And it continues to amaze us what's happening with this case. And the case took some turns, but it's just freaking amazing. Yeah. Anyway, thank you for doing some homework on that. We're out of time for today. Yes.
Yes. And thanks to everybody who showed up. The recording for this will be on Trinity this week, tomorrow, for 1 week for everybody to see. And then it goes back into Lynn's collected cases that's just for Trinity subscribers. There's lots of thank yous from the folks who joined us. And so next time our agenda will be talking about words and dermatitis, right?
Words.
Yeah. So
words.
the Queen's Wave. All right, guys. Love to you all. Talk soon. Bye-bye.